that, we'll have a roundtable discussion on the novel coronavirus's impact on our physical and mental health when we talk to Dr. Aisha Terry and Dr. Eunice Peterson. Also joined by Aisha Terry. She works in D.C. and is an advocate for the Congress for Emergency Medicine. Ladies, I want to say, first of all, thank you for being there in terms of at the front lines and battling this pandemic. Far too often, when we talk about health disparities in the black community, one major disparity is that far too many people in our community don't have a primary physician. In fact, when we have some type of illness, we end up and head immediately to the emergency room of the public hospital. In that regard, how has our treatment for our day-to-day illnesses, let alone COVID-19, have been impacted?
Well, first, thank you so much for having me. I do appreciate the opportunity to share, and that is really an excellent question. We know for sure that African Americans and other communities of color, such as Latinos, are consistently being disproportionately affected by COVID-19 relative to severity of disease and also death. Across the country, we continue to hear that we're seeing up to 80% of COVID-19 deaths amongst African Americans, even when the percentage of African Americans in those communities is much lower in terms of just general population. And
Chicago's a perfect example of that. Chicago's
absolutely
a perfect example, with 30% of the population but accounting for 70% of the deaths.
Absolutely. I practice emergency medicine here in Washington, D.C., and we're seeing about 80% of the deaths amongst African Americans, even though African Americans make up about 40 or 45% of Washington, D.C.'s population. And so it's a phenomenon for sure that's being seen across the country, even in Milwaukee and New Orleans. Every single city has seen this very clear, disproportionate, disparate effect. And again, it leaves us wondering why and how do we address these jaw-dropping statistics. We know that this unprecedented pandemic has truly opened our eyes and magnified us, really the chronic inequities in health and healthcare in our country. And it really has highlighted many of the social disparities that exist in communities of color. And we believe that that is why we're seeing a lot of the disproportionate effects. There have been so many theories to explain the disparities, including the role of increased underlying chronic conditions like hypertension and diabetes, which we do know predominate in communities of color. But also there are other rationales that could explain this disproportionate effect, such as low socioeconomics affecting access to care. You mentioned the role of primary care or lack thereof, and how there are several communities of colors with poor access to good primary care, such that they end up using the emergency department for primary care. Although we know that that is not just a phenomenon, certainly amongst communities of color, but generally there's an opportunity here to educate the nation around proper utilization of care and the importance of having really good access to primary care in order to manage chronic underlying conditions like hypertension and diabetes. We also just know, too, that the higher proportion of people of color being affected by COVID-19 certainly could be related to the fact that in terms of incarcerated populations, there tends to be a disproportionate percentage of people of color there. And in those environments, it's more likely to be at risk for catching a communicable disease. We also know there's inadequate awareness and education in communities of color, including some circulating conspiracy theories and myths. Yeah. There's distrust of the government and healthcare system by people of color to some degree due to past historical indiscretions, which can't be discounted. And then we know there's the role of bias and what some refer to as even racial capitalism that certainly plays a role in terms of what we're seeing now with COVID-19 infections.
Dr. Peterson, when you heard what Dr. Terry just talked about in terms of this disparate and really play out of the causes as well as the effects of the disease. When we look at ourselves, what are the warning signs that we need to have pop up in our minds or in front of our eyes that say, hey, you know what, things aren't right now. You know, this anxiety that I'm feeling, this irritability, this suppressing of grief, which unfortunately is far too real, because nowadays, even if there isn't the death associated with COVID-19, the reality is that the normal grieving process that existed before COVID-19 is not implementable nowadays with having to shelter in place. So what I really wanted to say here was, what type of warning signs should we be aware of to say that, hey, I need help?
So it's important to know that African Americans are 10 to 20% more likely to report having serious psychological distress or serious mental health problems like depression than the general population. So that's at baseline pre-COVID-19. And I would imagine that as our communities are impacted more significantly, that there's going to be an even higher risk. So some of the signs that people should be aware of are the following. So it's not just having a sad mood, but having a sustained sad mood for more than, if an adult, more than 2 weeks. If it's a child, more than 1 week, a loss of interest in pleasurable activities. So things that normally we enjoy or that help us to relax, we either don't participate in anymore, or we don't get any type of relief or pleasure from participating in those activities anymore. Tending to isolate. So there's a difference between shelter in place and isolating. So by isolating, I mean not wanting to connect with your family, not wanting to connect with your friends, or feeling sort of an absence of feeling, almost feeling numb, or if your feelings are sort of wrapped in cotton, if you will. So not being able to feel, feeling sad, not feeling connected, not being able to enjoy things in life, disturbances in sleep. So either sleeping more than normal or having difficulty falling asleep or being able to stay asleep, having changes in appetite, so either eating quite a bit more or eating quite a bit less, to the point where there's involuntary weight loss, changes in energy, so feeling tired no matter how much rest you seem to get, or having a sort of restless, purposeless energy where it's difficult to sit still. You find that you're moving quite a bit, but you're not necessarily moving to achieve a particular action. Those are some of the things that, if they interfere with one's ability to do what they're supposed to do. So if it's a child, to complete their schoolwork or their chores, or if it's an adult, if it limits their ability to perform on their job or be able to maintain their household, then those might be signs that that it would be helpful to contact a mental health professional to see if there's additional support that can be offered during this stressful time.
Talk about the issue of having a lack of doctors like yourselves, doctors of color, that people feel more comfortable relating to, especially when it comes to mental health issues, and also having doctors that are black, that are primary care physicians. Dr. Terry first.
That is an outstanding point for sure. And again, this pandemic has just really magnified so many issues that have been a problem in our society for many years. And one of those issues has to do with workforce, and it has to do with workforce diversity within medicine. We know for sure that people of color who go into medicine are more likely to practice primary care. They're also more likely to practice in underserved areas. And we also know, based on data and studies, that when there is racial congruence between a physician and the patient, there tends to be increased patient satisfaction, there tends to be better adherence and compliance with what is the prescribed plan, and there also tends to be longer, more meaningful visits between the patient and the provider. And so now more than ever, as we're seeing communities of color disproportionately affected by COVID-19, it is imperative that patients have access to medical care and physicians that they feel they can trust and that they can relate to, and that serve the purpose needed to improve their outcomes. And so there needs to be increased, I believe, focus on increasing the pipeline relative to really fortifying the workforce in terms of people of color going into medicine. We know that right now, only about 4 to 5% of all physicians are African American in this country, despite the
with 12% or 12 to 13% of the population, but yet only 4 to 5% of the doctors.
Absolutely, and that's in the year 2020. And this is, again, something that's been discussed for years. And COVID-19 is really, again, exposing the really dire need to address this really important issue.
Yeah. Dr. Peterson, did you want to add on to that and also give me an idea in terms of what prompted you to become a psychiatrist?
So I'll just agree with what Dr. Terry mentioned and just offer that, in my opinion, the lack of diversity, the lack of culturally competent providers in our community is devastating. And again, devastating. Echoing what Dr. Terry mentioned earlier, we have sort of this sense as a community of not being able to trust in the institution of medicine for historical missteps, if you will. And so if we combine that with the perception that our community also tends to have that mental illness is a sign of personal weakness or a character flaw that contributes to our unwillingness to recognize when we have challenges and our unwillingness to accept mental health as a component of health. When we consider the fact that our first not line of defense, but our first seeking of care, our first seeking of treatment is, I don't believe it is in the ER or urgent care. I believe it's at home. We tend to medicate ourselves, and by the time we actually seek help, often the issues have progressed much more than they would have needed to or would have had we sought help earlier. So really want to encourage us to consider that this is an opportunity as our deficiencies are being laid bare by this COVID-19 experience. This is an opportunity for us to do things like try to promote prevention and try to create a greater sense of willingness to seek care while acknowledging that the institutional barriers to care exist. The lack of insurance, the lack of being able to see someone who looks like you where you don't have to explain who you are or how you are, the sort of acceptance of the challenges that you have without necessarily having to communicate them can make a big difference in whether or not rapport is able to be established between a patient and a provider. And it is rapport, as Dr. Terry mentioned, which will contribute to adherence to treatment recommendations and therefore health outcomes. So to circle back around, it's devastating that there are not more African American or people of color who provide mental health. I think that it is something that hopefully we will be able to better address as we try to encourage people to accept that mental health is a part of health. Yeah. And I think if we're able to destigmatize mental health, then more people will get the help that they need. In terms of what led me to this career, I really feel as if it's a calling, not just a career. Mm-hmm. When I went to medical school, I didn't really consider psychiatry as an option for me. I just didn't consider psychiatry, period. In my community, psychiatrists, if they were referred to at all, were considered, I'll say, quacks, if you will. Yeah. So there just wasn't an appreciation for psychiatry being a significant illness, or not psychiatry, but psychiatry being a significant practice of medicine.
In fact, they originally were called alienists.
Right. Mental health was not considered equitable to somatic health concerns. And so, but what I found, like I said, is that I was led to this position. It turns out that I was blessed to have certain natural talents, and I knew when I wanted to be a doctor that I wanted to serve the least of us. Like I wanted to be able to help those who might have challenges in helping themselves. I wanted to serve the underserved. And when I was in medical school, I really came to understand that those who suffer from mental illness may be people who truly are not able to have a voice, and I felt compelled to help them have a voice. It was important to me because when I was exposed to psychiatry in practice, so many people who were in underserved communities, if they were willing to get mental health treatment, the services were being provided by people who didn't understand their culture, who didn't really speak their language, if you will, and so they were at disadvantage. They were the disadvantage were at greater disadvantage, and so I think that when I decided to pursue psychiatry, it was something that happened to be a nice marriage of what my personal and professional goals were in trying to serve my community and also realize my faith walk, if you will.
Indeed. And I guess I also would be remiss if I didn't ask you, Dr. Terry, what prompted you to choose the position that you currently hold?
Right. So I chose emergency medicine because I, really appreciate being a jack of all trades, if you will, rather than a master of one. And so in emergency medicine, we see patients from all walks of life with all kinds of conditions. And you have to really be prepared to manage that condition on the spot, and you have to know a little bit about a lot. And I really appreciated that. I also really appreciated the ability to take care of vulnerable populations and individuals who otherwise might not have anyone else to speak on their behalf and to care about their medical condition and their health. I appreciate that emergency medicine in many ways serves as an equalizer, such that I may take care of a homeless gentleman, and 5 minutes later, I'm also taking care of a senator, a U.S. senator, for example, right next to the homeless person in the same emergency department.
Right there at GW.
And, right there at GW, right here at GW in Washington, D.C. And it's, it's a pleasure, really, to have that opportunity to take care of individuals regardless of their ability to pay, regardless of their walk of life. And I can appreciate that very much. Not to mention, it's a really exciting field, obviously. I'm the first physician in my family, and so to have the really honor and privilege to serve as a physician has really been outstanding. And just to add to that, the thing is, it's great that we're physicians and that we love what we do. But it is just so important that we as communities of color emphasize the importance of expanding the number of physicians in our community that are of color. It really has to be an important priority, and that we need to understand that starting with children early on in the pipeline, to encourage them to learn about science and math and engineering, and to consider even having a career in medicine is so important. We have to start early and train our children to keep their eye on the prize in terms of that particular career being a real possibility for them. And I think that the more that they see physicians of color like myself, the more that they realize that, hey, I too can do that. And do it successfully. I also just wanted to mention along those same lines that I do serve on the board of directors for the American College of Emergency Physicians, and we have about 40,000 members worldwide, emergency physicians throughout the land. And one of the initiatives that ACEP has taken on over the past few years has been around diversity and inclusion. And with that, there was the development of a diversity, inclusion, and health equity section within the organization. And I just wanted to mention that this group of emergency physicians have taken on the initiative of sending out letters, a letter campaign, to leaders of communities of color all over the country in order to get a message out to communities of color that, one, emergency physicians care that you're being affected at disproportionate rates. I think it's important that patients in the community understand that, one, physicians care, that we're noticing,
yes, it is.
And that we are concerned. And also in that letter campaign, we are insisting that the message be brought to our churches and our Greek organizations and all of our various community organizations that social distancing is something that should be adhered to, that hygiene in terms of hand washing is very important, that we manage every single day our chronic underlying conditions like hypertension and diabetes so that when a pandemic hits, we don't find ourselves at a disadvantage.
Yes.
And that we really understand the concept around being our brother's keeper. Because truly, more than ever, this pandemic is just about that. It's not enough that I keep myself safe, but it's important that I keep myself safe and keep others safe from me by wearing a mask, by socially distancing, and understanding that it's not just about me. We know that in
that's going to have to
African. Okay.
Unfortunately, I think that incredible words of wisdom there. It's just that the clock is up against us. I want to thank Dr. Eunice Peterson as well as Dr. Aisha Terry for joining us this morning, and I can